Hello, everyone. Welcome to this third episode of the vaccine controversy, where we talk about the COVID vaccines and some of the concerns people have about them. Before we get started, I want to say that disclaimer, my employer is not endorsing my views. These views are just purely mine. They are not representative of anybody else's thinking, not the government's, not my employers, not any group of people. This is just my research that I did, and I want to share with people so that they understand a little bit better, hopefully, about the COVID and its vaccine. The second disclaimer that I want to do today is to tell you that I have absolutely no financial gain expected or realized or will be realized by me doing these videos. I do not have anything to gain from pharmaceutical companies. I have no financial interest in them. I don't take any money from them. I'm not on the speaking board of anybody. I don't eat their lunches. I don't take gifts from them. I don't own any stocks in the vaccine companies or any of such things. And I've done that on purpose so that, whenever I am able to speak to my patients, whether about COVID or diabetes, any of the things I manage, I would be able to speak freely and make a recommendation freely without having any ties or any benefit from any pharmaceutical company that would reward me for what I'm saying or punish me for what I'm saying or whatnot. So that way I'm able to speak freely and just express my own mind. So we are trying to talk and engage in a respectful way of some of the controversies surrounding the COVID vaccine. We talked about two of them already. Can we trust the government, pharmaceutical companies, big pharma, and so on? Number two is we talked about, is COVID a big thing, or is it just made up crisis, fake crisis, nothing to worry about? And should we do something about it in view of this or not? The third objection is something that goes like this. Okay, well, I get that COVID is real. I get that COVID can be a problem, but I think that the side effects of the vaccine, the harm that can happen to me from the vaccine, is bigger than any potential gain I can get from the vaccine. So in other words, the risk-reward ratio from that decision to take the vaccine is just not there for me. I don't think that it's in my benefit to take the vaccine. And I can definitely understand the argument and empathize with it. And it's an argument that I've considered for a very long time before taking the vaccine myself. And a part of it is the side effects of the vaccine were kind of toned down by the media and the pharmaceutical companies and so forth, whether that came from a good place or not a good place. Obviously the pharmaceutical companies, big pharma, have an interest in minimizing the side effects of the vaccine, but also there is the thought process in media that if we just kind of reassure people about the vaccine side effects and brush it to the side, then people will be more likely to accept the vaccine, which I definitely don't agree with, because I think it's a way of disrespecting people's intelligence, because people will find out. Truth always comes out. And when it does come out, then people are just going to be very disappointed and extremely unlikely to trust anything else that is being officially endorsed. So I think, I'm a Christian. I believe that truth will set you free, as we say in my religion. So I believe that you just say the truth and let chips fall where they may. So this is something that I believe in very strongly. And so we need to think of the side effects of the vaccine. Now, let me do this in 4 points. Number one point, and I'll start by the easier ones to respond to, if you will, versus the more difficult ones to address, or more complex things that I need to explain. So the first ones that are just easier to respond to is side effects that have been kind of feared, but really have no way of happening, or I don't really think this is a serious threat at all. So for example, there are people out there who say the vaccine can cause infertility. I just don't have a mechanism where this would happen. Understanding how the vaccines were made and how they are supposed to work, there's just no way that I'm aware of that this could be the case. Now, again, my field is endocrinology, so I deal with hormones all the time and the endocrine system. So I'm not saying that a side effect, any side effect of anything cannot happen. What I'm saying is for a side effect of a medication to happen, it needs to make sense in terms of how this medication or product works in the first place. I mean, if something is working on an organ, you're hard pressed to find out how it causes side effect on an organ that it's not even supposed to touch or not supposed to have anything to do with. So if somebody has an argument to the contrary, can explain at least in theory or hypothetically how that could happen, I'm willing to listen to any argument. But so far, I have not seen anything that would convince me this could be a thing in the first place, right? Now, that's argument number one. Argument number two is an argument that a lot of people have and hold on dearly to, and I've seen witnessed how people can be very strongly pro-nature and naturopathic and want to do things in a naturopathic way. So I'm not minimizing that concern whatsoever, but I just want to reason about it with you. So that the second concern or objection, coming from people in that vein about side effects of the vaccine, they would say, well, instead of getting something artificial like the vaccine that has potentially a lot of side effects, why don't I just improve my immune system? And so my immune system will be able to fight off the infection better in a natural way. And that is obviously an argument that I can understand, that I can relate to. I can see how it was made, but at the same time, I can see the fallacies with it. So if you don't mind, I'm going to talk about some of those shortcomings in that line of thinking, right? So the first thing, the first shortcoming is the vaccine is aiming to do that. A vaccine by nature is aiming to exactly do that, which is to stimulate your immune system in a specific way against this disease that you are afraid of getting. That's how vaccines work in general. So they stimulate the immune system. They are not, getting immunity from outside for you. It's your own immune system that's being actively recruited to help fight this particular infection that you're afraid of getting. Okay, but the person who has this argument will say, oh, but the vaccines are not natural. They are made in a lab by humans. They are not made, they are not present abundantly in nature. And well, yes, of course they are not. But again, you are fighting off in general things that are diseases and infections and stuff like this, and natural occurrences by things that are artificial in the first place. Let me give you an example. Hurricane. How do you fight a hurricane? How do you, that a hurricane is coming your path? Is a hurricane natural? Yes, it is natural. Now, okay, so how do you fight a hurricane? How do you get out of its path? Well, you're using things that are completely man-made, completely artificial, whether it is a prediction model that is based on science of the path of the hurricane, or whether it is a car that was made in a factory that you use to get out of the hurricane path, or a cell phone that's used to communicate with other people to use that technology. So all of these are not natural things that you are using. These are man-made, artificial things that you are using to combat a natural phenomenon. So if you believe, okay, well, COVID is a natural phenomenon like any other disease, then you still fight other diseases with artificial methods, even antibiotics. I mean, what are antibiotics? Are antibiotics, I mean, who would get a pneumonia or a sinus infection or something that requires an antibiotic and say, well, I'll just, drink green tea? That obviously is not going to be sufficient to treat the infection. So why? So if you've already established that you are ready to use something artificial to combat a disease, and you don't just depend simply on your immune system to fight off that disease, why do you draw the line at COVID? Why do you say, okay, well, COVID is the only thing I'm just going to do all natural stuff against? I'm not just going to use anything artificial. And by the way, if you are using that argument, then obviously a lot of other things go out the window. So one of the things that, again, Joe Rogan has done this podcast saying, well, I feel great because, I didn't take the vaccine, right? But that's what Joe Rogan said. But I took, once I got COVID, I took ivermectin, and I took the monoclonal antibodies, and I took, the medications and vitamins and a ton of stuff. Well, I mean, are these things present in nature? Do you find ivermectin in the field or in a forest, for example? Or do you see monoclonal antibodies laying there on the grass somewhere? No, these are all man-made. So you cannot use that to say that this is, I'm going to only use natural methods to fight off something that is affecting me. You already are kind of undermining your own argument by using anything that is artificial, that is made in a lab. So if you're going to use something artificial anyway, my point is you might as well use something that works. Okay, now that is an argument about it. And obviously, there is a concept that I think that a lot of people need to consider, is that not necessarily everything that is natural is good. I mean, hurricanes, are they natural? Yes. Are they good? No. So earthquakes, are earthquakes artificial somehow, made in the lab? No. But are they good? Again, no, they are not good. So something can be totally natural and still not good. And you still have to fight it with something that is artificial or made by people or made scientifically, but good. I hope that makes sense. Now, okay, so the argument number 3, or along the lines of side effect argument, is the arguments of things that are common but not severe. These are symptoms that a person gets, when they get the vaccine. So local reaction, redness, hotness, pain, tiredness, feeling fever, having joint aches for a day or two, or not feeling very well for a couple of days after taking the vaccine, that normally just resolve and go away with time. Those are obviously things that are, these are side effects that can happen. That doesn't mean that they happen to everybody. Okay, many people get the vaccine, they don't know that they received anything. They just didn't feel the shot, they didn't feel any side effect at all. But some people get mild symptoms like this, mild problems like this, that happen after they take the shot. What do these things usually indicate, especially in cases of fever, joint aches, myalgias, joint muscle aches and stuff like this? What does that mean? It usually indicates that your immune system is actually responding to this injection that you received and is starting to activate and form antibodies. So in a way, you can think of it as a good thing. It's the outcome that you were hoping for. You definitely didn't want to get the vaccine if you get the injection and say, okay, well, I'm not going to have, you know, any response to it. If you're getting some form of response, you know, you can take it as an indication that the vaccines actually work, that is producing what it's supposed to produce, which is to make your immune system activated against that, you know, that target, that virus that you're trying to fight. The fourth argument is the most complex one, and that I need to obviously talk more in details about, because that's the one that held me from getting the vaccine for a long time. You know, obviously I got the vaccine in March and April, but you know, I was considering various types of vaccines and how they work, what they were, how you know, effective they are, and what kind of side effects are to be expected. And I had to do my own research, because I think the general atmosphere was, you know, an atmosphere of kind of minimizing all the side effects and saying that, you know, they don't exist, or, you know, people who even question, you know, those side effects are conspiracy theorists, which is very unhelpful. I understand the mentality of people who are saying this, is that they want everybody to be vaccinated because they think this is in their best interest. However, people are free, and so we need to respect the individual free choice of everybody. And what better way of doing that than, you know, making sure that they know everything that is to know about those vaccines. So to explain this point about number 4, which is vaccines can have serious but very rare side effects. Now, to explain that, we need first to know, how does the COVID vaccine, how is it structured? What is it supposed to do? So there is a part in viruses that is called a spike protein. The best analogy I can give you is, if an invading army comes in a fleet to basically invade your city or your town. If you are in a port city or a sea city, let's imagine that you're somewhere in the you know, 18th century or so, and then there is a fleet that is coming to invade your city. Now, those ships, in order to attack the city, they need to dock at the harbor. They need to either lay down the anchor, or they have to dock with some other method to the harbor, and then they have to get all the passengers, who in this case are the invading army, coming in and kind of doing their damage inside of that city and attacking people who are living there. Okay, so if you think of the virus in the same way, the docking mechanism, the anchor, or the cleat, that's the metal part on a ship that you tie a rope to, and then tie a rope to the another cleat that is on the dock, so that the ship would be able to dock, and then people would come in from the ship to that city. So that that docking mechanism, whether it be the cleat or the anchor, is what is considered the spike protein of the virus. So it is that protein that's on the surface of the virus that makes it able to attach to your tissue cells and kind of then release the virus inside of your tissue cells, right? So what does the damage to your organs? It's the passenger inside of the virus, which is in that case the nucleic material that the virus unloads inside of your tissues and inside of your cells, that starts to multiply and take over that cell basically and claim it as its own, or destroy it. And then that is how all the effects and bad symptoms that come from virus infections, they affect you and take over your body, basically. So the idea here is that you're making an antibody to attack that spike protein. So that antibody that is used to attack the spike protein is what the vaccine is trying to make in your body. It's trying to make your own immune system get ready and manufacture antibodies that attack the spike protein. If you think of it, of that analogy that I was just mentioning about the fleet, it's like having arrows that are designed to cut off the anchor or cut off the cleat or destroy that docking mechanism of those ships so that they cannot unload the people who are in them. The army cannot come into the town, cannot destroy your town. So because of that, that should tell us a lot of information actually when you think about it, because if there is something that is you're worried about, it should be the virus itself rather than the cleat or the anchor. So if we're talking about the virus itself, it's the virus, it's the army that is the most concerning thing, or should be the most concerning thing for you, because that army is going to come in and destroy your tissues. It's the nucleic material inside of the virus that is being unloaded into your tissues. That's what you're hoping to avoid, right? So the attachment itself is not what's going to cause the damage. The attachment of the virus to your cells is what allows the damage then to take place. I hope this analogy makes sense to you and kind of helps understand a little bit. So it flows from that anything you decide to do, okay, to fight off the spike protein is much better than having to fight the entire army inside of your cells. So if there is anything that you're worried about from side effect of the vaccine, you should be worried more about the side effect of the virus itself. You know, because in the vaccine, you're just producing an antibody against the anchor or the cleat. But in the viral infection itself, you're having to deal with the actual army that comes off the ship. So which one is more dangerous, the cleat or the mechanism you use to fight it, or the army, the actually armed men who are going to come into your city and destroy it? Well, obviously it is the fleet. So I'm not saying not to be concerned about potential side effects from vaccines. You should be concerned and should consider it, but you should consider more the side effects and problems of the virus. I mean, if you say, well, I'm just worried that the vaccine will cause something for me, well, you should be worried more about the virus. It doesn't make sense to be worried only about the vaccine. You know, you can be worried about the side effects of the vaccine, but you should also at the same time be more worried about what if not just the cleat and the anchor and all that, but the ship attached and then the army came. So I'll have all the bad things that could happen from the vaccine, but more, I'll have a ton of more stuff happen as a result of that invading army coming into the town and city, right? I hope that makes sense. Now, what are those dangerous but rare side effects that are, you know, now with the vaccines of Moderna and Pfizer, which are supposed to be modeled in a new and different way called mRNA? There is the potential of causing heart muscle issues, and you know, the antibody can have those effects on the heart muscles, as well as other effects that can happen as a result of almost all the vaccines that are rare. There is a question mark about how much they affect the platelets, about how they affect and possibly how they affect the clotting mechanism of the body, and so on. So there are many things that are question marks that with all the vaccines, but to various degrees with one more than another. So for example, that concern about blood clots forming, that is more of a concern with AstraZeneca vaccine than it is with either Pfizer or Moderna. But the heart muscle problem issue that we discuss is more of a problem with the Pfizer and Moderna than it is with something like Johnson & Johnson or the AstraZeneca. However, you know, all of these side effects are rare, and they are, again, the biggest argument is which one is more likely to happen, that you get a side effect like those that I mentioned, or that you get a problem, an effect from the virus itself if you get affected. You know, to me, the balance was clearly that the risk of a major side effect like this was very, very, very small. But the risk that I would get sick if I got the virus is actually much, much, much higher. So for me, then the balance for me was that I would take the vaccine and take that small risk of a side effect to protect myself from the much more likely event of suffering if I got the viral infection itself. And I think that choice makes sense for almost everybody. But again, it's your decision, it's your choice. And I hope that we can agree to discuss everything respectfully. If you don't agree with me, that's fine, it's your right. But this is how I'm thinking about it. One last thing before I finish is, remember last time I told people it's okay to believe statement A or statement B, but you cannot logically have both in your mind at the same time. You know, well, here is something like that, is that it makes no sense to use the monoclonal antibody if you are against the vaccine. Because what is a monoclonal antibody? It is an antibody that is made in the lab, okay, and that is supposed to, again, target the attachment of that virus to your tissues, right? Now, the monoclonal antibody is made in the lab, so that takes away the argument of nature. You know, it's not, you cannot call it naturopathic, but more to the point is it works the same way as the vaccine is supposed to work. Only with the vaccine, it's your immune system that is being propped up to help fight any future infection. But with monoclonal antibody, you're just getting those antibodies pre-made in the lab. So if you logically decide it's not a good idea to fight this infection with antibodies anyway, then why are you taking monoclonal antibody? I mean, you have to decide one or the other. If you want to be consistent, you can say, well, I'm completely against fighting off viruses by antibodies. In that case, you don't take the monoclonal antibody, you don't take the vaccine. Okay, I disagree with you, but I respect your opinion anyway. However, if you decide that, I'm going to not get the vaccines are bad, but the monoclonal antibody is good, that doesn't make much sense. Now, obviously, people, I want to say this so that people don't misunderstand. People change their opinions all the time. Like a person can realize, like, let's say they didn't take the vaccine, okay? And then they realize, okay, you know what? This thing is really severe. I'm really having a lot of hard time with it. I'm getting a lot of symptoms. I got the COVID. I should not have suffered that much. I'm going to ask for monoclonal antibody. Okay, sure, but then, please do. I mean, I'm encouraging you to do it. I'm not discouraging you from doing it, but understand that this is a change of mind. You can't, after, like, hopefully you got the monoclonal antibody and you improved. After that, what you shouldn't really do is to say, oh yeah, that was the right thing to do. I shouldn't, I'm still glad I didn't take the vaccine, but I did, get the monoclonal antibody, because that just doesn't make any sense. They are both supposed to work the same way. So it's okay if you change your mind, but you just can't hold those two thoughts together in your mind and say that you're right, that vaccine is bad, but monoclonal antibody is good. It just wouldn't make sense. So I'm just trying to help you to be logical, to be consistent with your own thinking, rather than just making an argument that is not wise. I hope this answers some of the objections. Next time we'll talk about some more questions about the vaccine and COVID. But please, if you have any further objections or questions, put them in the comment section. And if I find that several people have a concern, then I'll make video about it. So until then, be safe and goodbye.